Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. I can see you're feeling a bit uncomfortable. I'm Jordan, your nurse, and I'm here to talk with you about how your bowels have been moving since your surgery. First, could you tell me in your own words what has been happening with your bowel movements?
Oh, Jordan, it's been 2 days now since I last went to the toilet. I feel so bloated and heavy. I've tried to push, but nothing comes out. I'm worried something is wrong.
I understand your worry, Mihiraa. Let me ask you a few more details so I can help you better. Are you feeling any pain in your tummy, or do you feel sick to your stomach?
I have some cramping low in my belly, but no vomiting.
Also, when you try to go, does the stool feel very hard, and are you able to pass any gas at all?
The stool feels very hard, like small stones, and I cannot pass gas either.
Thank you for telling me all that, Mihiraa. Please let me reassure you about what is happening. This is actually very common after a thrombectomy, especially on day 2. The reason is that both the anesthesia you received during the operation and the pain medications you are taking now naturally slow down the muscles in your bowel. This is not dangerous, and it is usually a short-term discomfort that we can manage together. Many patients go through the same thing, and with the right steps, your bowel will start working again. So please do not feel that something is wrong with you specifically. Now, to help you better, could you tell me about the laxatives or stool softeners that the doctor prescribed for you? Have you been taking them regularly as instructed, or have you had any trouble with them?
I took them as prescribed, but I don't want to take medicine if it isn't helping.
I understand your situation. Mihiraa, let me now talk with you about the foods and drinks that can gently help get your bowels moving again, without causing any extra discomfort. I suggest you try eating some fiber-rich foods that are soft and easy to digest. For example, cooked prunes are very helpful, as is wholegrain bread. Legumes such as lentils or beans are also good, and you might enjoy a small bowl of oats or bran cereal in the morning. These foods add bulk to your stool and help it pass more easily. Along with these foods, drinking enough fluid is very important because fiber needs water to work properly. I encourage you to aim for 6 to 8 glasses of water every day. Warm fluids like tea or warm lemon water are especially soothing for your bowel. Prune juice is excellent as well, and for fruits, try to eat papaya, kiwi, or oranges. These fruits have natural enzymes that soften the stool. Would you be willing to try adding 1 or 2 of these options to your meals today?
I like prunes and oranges. I can try that. But I'm still worried because I can't push hard. My leg hurts from the surgery site.
Mihiraa, I am so glad to hear that you like prunes and oranges and are willing to try them. That is a wonderful first step. And I completely understand your worry about not being able to push hard because your leg hurts from the surgery site. Please let me reassure you that you should never strain or push hard. That is not safe for your leg or your bowel. Instead, there are other gentle strategies that work very well without any straining. First, gentle mobility means simply walking a few small steps to the bathroom with my help. Even that small movement can wake up your bowel. Second, you can try abdominal massage, where you lie on your back and gently rub your tummy in a clockwise direction using soft, slow circles. This stimulates the natural movement of your bowel. Third, when you sit on the toilet, I can bring you a small footstool. Placing your feet on it, so your knees are higher than your hips, changes the angle of your rectum and helps stool come out without you needing to push at all. I can show you how to do each of these when you are ready. Before we finish, Mihiraa, do you have any other concerns or questions? I want to make sure you feel completely comfortable.
That footstool idea sounds good. How long should I wait before calling for help if nothing happens?
Mihiraa, I am very pleased that the footstool idea sounds helpful to you. That is an excellent question you have asked about how long to wait before calling for help. Let me explain clearly so you feel safe and know exactly what to watch for. You should seek medical attention if you have no bowel movement for 3 or more days, even though you have been taking your laxatives regularly. You should also call for help if you develop severe abdominal pain that is much worse than the mild cramping you feel now, or if your belly becomes swollen and hard to the touch, which we call distension, or if you start feeling nauseous or vomiting. These signs mean we need to act quickly, so please do not hesitate to tell me or any nurse if any of these happen. Now, I would like to ask for your agreement on something very helpful for preventing this situation. Would you consent to scheduled toileting assistance after every meal? That means about 30 minutes after breakfast, lunch, and dinner. This uses your body's natural reflex to move the bowels after eating. Is that something you are willing to try, Mihiraa?
Yes, that sounds fine. Please help me after meals.
Thank you, Mihiraa. Let me quickly summarize what we discussed. Your bowel difficulty is common after surgery due to anesthesia and pain medication. You will restart your laxatives regularly. You will eat fiber-rich foods like cooked prunes, wholegrain bread, legumes, oats, and fruits like papaya, kiwi, and oranges. You will drink 6 to 8 glasses of water and warm fluids daily. You will try gentle walking, clockwise tummy massage, and a footstool on the toilet. You will call me if there is no bowel movement for 3 days despite laxatives, or if you have severe pain, swelling, or vomiting. And we have agreed that I will help you to the toilet after every meal. Do you have any final questions?
No more questions. Thank you, Jordan. You've been very kind.
You're most welcome, Mihiraa. Rest well and get well soon.